So, good afternoon, everyone. I'm sorry I've been off for a while. I've been busy. I've been busy with a lot of things, so please kindly pardon me. But right now, I'm back and better with a lot of goodies, with a lot of information to share with you guys. So I want you to sit back, relax, and enjoy. And please, if you haven't subscribed to my YouTube channel, please kindly subscribe to my YouTube channel. Kindly share, likes, and comments. Thank you very much. I really appreciate. Now, let's go back to the main deal for today. So today we want to talk about how to care for your vagina, how to know when this is this, how to know when this is that. So most people feel that our vagina is just like a muscle. It's like a funnel that connects the uterus, which we all know as the womb, to the outside world. And it's we make use of the vagina a lot, especially the gynecologist. And the vagina is a muscle and a funnel that connects the uterus, that's the womb, to the outside world. And where is it located? Well, let me describe it in a layman words. It's located in between. Our laps. That stuff that is located in between our laps is called the vagina. But let me describe it better. You know the fleshy part, the fleshy muscle, that flap, the two flap that is on there's a flap here, there's other flap here. The two flap, we call it the labia majora. We have the bigger one, we have the outer one, we have the inner one. The outer is the labia majora. The inner one, there's another flap inside. The inner one is the labia minora. And also at the tip of the labia majora, we have what we call the clitoris. There's a fleshy muscle. And most of the olden days, we do mutilate it. That's why nowadays we are trying to educate our mothers, we are trying to educate our grandmothers that female genital mutilation should be eradicated. They are not supposed to mutilate we females. The clitoris is there for a reason. God created the clitoris for a reason and not for it to be mutilated. And also below the clitoris you have a small opening. The small opening is where anytime you want to urinate, that's when the urine comes out from. Not that so many people think the urine comes directly from the vagina. That's why I'm always surprised when some lady will say, I come. Well, no, you actually understand it. When they say they come, you now see a lot of water. You are urinating. You are actually urinating because there is no how water is going to come out from the vagina. Because the vagina is just connected directly to the uterus, and the uterus is like a blind pouch. So, please, where is the water coming from? So that's why most people that say they are coming, I don't know where they are coming from, but they say they are coming, they are actually what? Urinating. I don't know. I'm just talking. So there is no connection. So that small opening just below the clitoris. And I want you to have a mirror to just check, do a self-examination and try to check all what I'm trying to explain to you. You actually get it right. The small opening is right below the clitoris. And that small opening is where the urine comes out from. Why below that clitoris? Below that opening, that small opening called the urethra, we have the larger one, that's the vagina. That's the real vagina, and that is what we actually want to discuss about. That vagina plays a big role in a female's life, a big and important role in a female's life. Once that vagina has a problem, no matter how your self-esteem is, will be very, very low. Very, very low. At times, some people even run into depression. But that's why I'm trying to give you this small piece of knowledge. Try to care for your vagina. So, after knowing the location, knowing everything, What are the properties that helps to keep our vagina in check? One, your vaginal pH. Your vaginal pH is very important. I see no reason why nowadays ladies insert a lot into the vagina, but they don't know that they are causing more harm than good. They're causing serious harm than good. There's all these, there's even more yoni pills. One had to say that once you put it inside, there will be this big thing that will come out. Man, it's actually nonsense because the vagina is actually self-cleaning on its own. It cleans itself. The acidic pH, the, God, the way God created the vagina, God created it in such a way that no matter how any infection gets into your vagina, just because it is acidic, it's going to kill everything. Even if you try to say just normal sperm, once again released in you, that acid that is there, if the sperm is not really very active, the acid is going to kill most of them. That's why some sperm they call it shaking on the spot. They'll be shaking on the spot. But if the sperm is very active, let's be careful. Know what you insert in your vagina and check apart from all this medicine, apart from what doctor prescribed to you, do not use anything, do not insert anything into your vagina. It changes the pH. And also those labia majora also helps. It helps in protecting a lot of things. And please from them. How do you keep your vagina? One, try to prevent, try as much as possible to wear cotton pants. Stop putting on panty liners. Panty liners actually affect it. Can categorically tell you panty liner causes more infection because I've actually experienced it before. I had to stop it. It causes more itching, intense itching. So I would advise people, you guys, to stop using panty liners. If you're having any scratch, you can only tap. Once you tap it, you'll feel relief. The thing that I try to tell people is that try as much as possible to keep your mind away from the fact that you need to scratch every time. If you try to train your mind against it, once you tap it, you'll be fine. You will surely be fine. And try as much as don't doubt. People involved in douching, they'll say they want to wash their vagina, they want their vagina to be smelling, they want to be scenting, to be doing this, to be doing that. Actually, it's not necessary. Don't doubt. Some people go as far as washing their vagina, their inside vagina with detergent. Does it make sense? So you need to stop all those acts. Stop washing your inside vagina with detergent. All this scented vaginal spray. You need to stop it. The both scented and unscented, you need to stop it. And also, some people don't like using pad because of the fact that they are not always comfortable with using pad. So people use tampons, but I always try to encourage them to use more of the cotton one, that they shouldn't use the tampon. But most people, they want to feel like they get. So I challenge them to use the scented one. Don't use the scented tampon. But if you can do it with both, you are good to go. And also after sex, try as much as possible to clean your vagina. Clean your vagina after sex. It is not necessary. You don't need to clean inside of your vagina. You can just use a little soap. All those medicators, you can put a little soap or water just to rinse the labia, the vulva. The labia majora, not inside of your vagina. The inside of your vagina, if you have not done anything to your vagina, is self-cleaning on its own. That's why I do tell people that if patient comes to meet me, doctor, I bought this pants last month, it bleaches, I bought another one, it bleaches. I said, yes, your vaginal pH is actually good. If your vaginal pH is very, very good, your pants will always bleach. But if your vaginal pH is not good, your pants will never bleach. Are you with me, guys? So let's try as much as possible to put that into heart and try to prevent the usage of all these herbal stuff that they will tell you to put inside your vagina if you want your vagina to be tight, to be tighter than before. My sister, don't let me deceive you. The vagina is very elastic. The vagina that can contain a whole head, a whole human being. The vagina is very elastic, and once it stretches, it goes back to its original self, original position. We can only try as much as possible to make your perineal muscles, your vaginal muscle to be firm by doing some exercises. Once you do all those exercises, it keeps your vagina firm. And also try to prevent all this. Put some people go as far as putting potassium to their vagina. Prevent all those stuff. All those stuff increases the pH. All those stuff increases the pH of your vagina. And once it increases the pH of your vagina, it exposes your vagina to a lot of infection. Serious infection. And if you want to have sex, have what? A protected sex. Do not have unprotected sex. Have protected sex. Have protected sex. Go to the hospital. Go to see your doctor. Have a regular checkup. Not until you have complaint, go to your doctor. Go to the doctor, have a regular checkup. Do all those regular tests, HIV test, hepatitis B test, syphilis test, and all the likes. Check yourself up. And what are the things you know that you have your vagina is having issue? Number one, if you have a smelly vagina, there are some vagina that smell like fish. There are some vagina that smell like rotten egg. If you are one of them, please go and see your doctor. Normally, females do have whitish vaginal discharge, which is normal depending on your menstrual cycle. But when it is abnormal, it is when it is happening. It is smelling. It is smelling. Even it depends on your menstrual cycle. Sometimes your vagina discharge will be so stretchy. That's during your ovulation time. To be so stretchy. Once you're ready to be stretchy, that's during your ovulation time. So all those things, just take it into cognizance and try to know which is which. Once you know that it is having this rotten egg smell, fishy smell, you need to see a doctor. Once you know that your vaginal discharge is cream, is brown, having different color from the normal color, the normal whitish color you usually observe, you need to see a doctor. Once you see some growing, there are sometimes you notice some growing from all the sexually transmitted disease like warts, genital warts, you need to see your doctor. When you notice some vaginal, when you notice itching, intense itching, even ordinary itching, might be as a result of candida infection, that's fungal infection due to heat and some other things. Or if it is bacterial infection, you need to if any itching, you need to see your doctor. Or you have any discomfort in your vagina, you need to see your doctor. Or any bleeding, you need to see your doctor. Those are the things you need to take into cognizance. Please do not insert anything into your vagina. Do not use any drug without a doctor's prescription. If you notice anything, kindly go to the hospital. And if you need more clarifications, or you want me to educate you more on some topics, I'll drop now. Hello, caring for your vagina is not difficult. The only difficult thing is when you disturb the normal well-being of your vagina. And please don't disturb your normal well-being. Don't disturb the normal well-being of your vagina. Don't insert anything into your vagina. Don't disturb the normal flora, because once you disturb the normal flora, you are even disturbing your whole health. And try as much as possible. If you want to clean your vagina, you can only clean the vulva with water or with soap. Do not clean inside of the vagina. I hope I've passed across my little piece of knowledge to you. And if you need any information, more information, and any clarification, you can beat me up on those stuff I drop on my caption. Please, thank you for listening. And please, if you haven't subscribed to my channel, please subscribe to my channel, please, so that you'll be able to enjoy a lot of videos, a lot of educative videos. Please subscribe to my channel. Please don't forget to subscribe to my channel. Click on that button below and subscribe to my channel. Like and share and comment. Thank you very much.